Common treatments for diabetes. The treatments for type 1 and type 2 diabetes are pretty much the same except for one difference. People with type 1 diabetes will be on insulin replacement therapy from the time they're diagnosed with it. Those with type 2 diabetes may not need it unless their condition escalates. In this video, we'll look at a few common methods that are used to treat diabetes. While this is a dangerous disease when it's out of control, it can be managed well if you monitor your blood sugar levels regularly. Diet. This is by far one of the best ways to treat diabetes. The goal will be to minimize your sugar intake and reduce your consumption of processed foods, which contain additives and high fructose corn syrup. When you clean up your diet and consume foods that are natural, wholesome and healthy, your blood sugar levels will stabilize, your inflammation will decrease, and it will be much easier to lose weight. Type 2 diabetes is often the result of obesity. Losing weight is one of the best ways to prevent or manage diabetes. A clean diet will allow you to do just that, if you're at a caloric deficit. Education. While not a treatment per se, it's a fact that you don't know what you don't know. Your doctor will educate you on what diabetes is, and how your blood sugar levels and glucose metabolism affect your condition. It's important that you do your own research and learn as much as you can about this disease. The more you know, the better you'll be able to manage it. Exercise. Exercise is so good for you that you should be doing it daily even if you're not diabetic. But if you are, you absolutely need it to improve your strength, stamina, and it'll help you shed the excess fats too. Tablets. If your diabetes is escalating, your doctor will prescribe medication for you to take. You may also be prescribed medication to reduce obesity, treat high blood pressure, etc. All these are common problems that afflict people who have diabetes. Metformin is a common drug that helps to reduce insulin insensitivity. It is very helpful for obese people who need help controlling their blood sugar levels. Metformin will prevent the body from overproducing glucose and it will inhibit the absorption of dietary glucose. Alternatively, if you can't handle metformin, your doctor may prescribe acarbose, that helps to block the digestive enzymes in your body from breaking down the carbohydrates into glucose and spiking your blood sugar levels. Insulin replacement therapy. Insulin replacement therapy is used for almost all type 1 diabetes patients. However, it is used as a last resort for type 2 diabetes patients. Basically, it involves injecting yourself with insulin. There are several ways to deliver the insulin into your body. There are injections, insulin pumps, skin patches, nasal sprays, etc. It all depends on your preferences, and this is best discussed with your doctor. The type of insulin you're prescribed will depend on your condition. There are different types of insulin depending on the time it takes for them to act. Some are rapid, and some are long-acting, and there are others in between. Once again, your doctor will be the best person to advise you here. These are just a few of the common treatments for diabetes. What's important is that you be proactive when it comes to treating this disease. If you're complacent about it, it'll escalate into uncontrolled diabetes and severe complications may occur. It can even become deadly. So, it's best to keep this disease under control. Thank you for watching our video. Don't forget to get our book 11 Herbs and Spices to Lower Blood Sugar.